the top of the Empire State Building.
Z100, New York.
It's Shelley Rome, and today we're talking about focusing on mental health in the new year. Obviously, the pandemic that we have now been in for almost 2 years, it's taken its toll physically, mentally, emotionally, financially on so many of us. Stress, anxiety, depression is on the rise. And whether it's because of uncertainty at work or in your relationship, trying to stay healthy, obviously, avoid COVID, it's very overwhelming. And I think prioritizing self-care is so important, and holding ourselves to it can be really difficult. A lot of people want to get help, but they just don't know where to start. So I'm really excited to be joined by Dr. Rachel Luckman to help us answer some basic questions about therapy and how to start prioritizing mental health. So hi, Dr. Rachel.
Hi, so nice to see you today, and thank you so much for having me on.
Of course. So how would you like to be addressed? Dr. Luckman, Rachel, you tell me. How would you
In the field, people really call me Dr. Luckman, but whatever you're comfortable
Let's do it. I don't know why I went to Dr. Rachel. I thought it was.
You want to be, we're friendly terms. It's different.
We're friendly. Yeah, it felt good. It felt cool. I don't know. Okay. So Dr. Luckman, please tell us a little bit about yourself and what kind of therapy you practice.
Yeah, so I have a PsyD, which is a doctorate in clinical psychology. Currently, I work in private practice, so I see individuals for one-on-one therapy. I specialize in eating disorders and body image concerns, but I see general range of anxiety, depression, relationship issues, career challenges, primarily working with college age and young adults.
Wow. Have you found that there's a lot of younger people are starting therapy as opposed to like now, as opposed to, I guess, I don't know, 10 years ago?
Yeah, I'm not too sure about like the statistics with increase in therapy. However, right now it does seem that I am getting outreach from a lot of people who probably wouldn't have been in therapy right now if it wasn't for the outcomes of the pandemic.
Yeah.
So some people seems like this is ongoing need, and then some other people seems like that there's just new stressors and new types of worries that are just out there.
Yeah. I mean, I like to hear that you're seeing patients on the younger side, because I feel like sometimes it takes people a while to even decide that they want to start therapy, but I love that. Okay. So speaking of like therapists, and what is the most important thing when it comes to finding a therapist? Somebody wants to start, they want to get into this journey. What's the most important thing?
So research shows that the best predictor of treatment success is the relationship between the therapist and the patient. So the most important thing is that you feel comfortable with your therapist. And so when people are looking online or doing word of mouth to find that therapist, really think like, is this the person that I can share, really anything with? You want to make sure that you're feeling safe. And then, we can talk more specifically about the steps of finding a therapist, but in the end, it's someone that you want to feel comfortable with.
We'll get to that. I mean, we'll get to actually the logistics of, what do you actually do to where do you go? But so you find a therapist. How do you know how long does it take? How do you know if you're comfortable with this person? I mean, how long should you give it?
Yeah, that's such a good question. And I don't think there is like one answer because everyone's different. But I would be just honest with the therapist that, some people it's slow to warm up and they might not really feel comfortable with someone for a few months.
Yeah.
Some people might know after a few sessions, but generally I like to tell people like, let's give it 2 to 3 sessions, check in how this is going. And people might say to me like, hey, listen, Dr. Luckman, you're really cool, but I was looking for someone that's like more structured. And so if I get that feedback, then I can also change my style to make it more of a comfortable environment. So I think it's also important to be transparent with what your needs are and how to have the therapist help get those needs met.
And I also think that comes with experience, right? Because I know I've had a couple therapists throughout the years, and I think you don't really know that until you've been in therapy for
Yeah.
a period of time. Because I know with the first therapist I saw, I, I didn't understand why I hated going, and I would cancel every week, and I would
Yeah.
always come up with an excuse. And with the therapist that I'm seeing now, I love going to therapy. And I remember the first session we had, I was like, oh, this guy's different, and I
Yeah.
never, ever, ever miss therapy. And so I think sometimes do you think it'll take a couple times, maybe a couple therapists to actually find the right one, and that's okay.
Yeah, exactly. It's kind of like dating.
Mm.
So not everyone is going to match with the same partner, right? So, and I say that to, my potential new patients on the phone intake, like, I might not be a good fit for you because it's not possible for me to click with everyone. And that's normal. That's part of having a connection. We can't be connected to everyone. And so that's completely okay and a normal part of the process of finding a therapist.
When someone's just getting into therapy and they're questioning whether or not they should go with a male or female, how do they approach that?
Yeah, so it's interesting. There are different theories about gender. Some older traditional, like Freudian theories, talk about how gender might not be the most pressing concern because we can, see the therapist as a different type of person.
Mhm.
However, other theories really do talk about how different genders can bring up different forms of safety. And so, really, I think, go with your gut. If you feel really safe with a certain gender, then so be it. And if gender is not the primary concern, then that's okay. And I think I might be a little repetitive today, where I might be saying that a lot of things just aren't cookie cutter.
Listen, but I think it's honest because
Mhm.
as a therapist and someone who is been in therapy for now quite some time, like there's no black and white answers. Like it's
Yeah.
all so gray, and it's whatever. So many different things work for so many different people. Like, there's we want, and you can say this, you can probably as a therapist, maybe validate me or not. We want everything. We want the answers. We want it done
Yeah.
tomorrow. Like I want to come in tomorrow and you tell me I have 6 sessions. Yeah, I'm going to tell you, what you need to work on, how to get there. And it just doesn't work that way. We don't have those answers.
Yeah,
Like,
Shelley, you're so right with that because we live in this world right now where there's so much uncertainty. And so when we feel like everything's out of control, we want to try to make control in our lives. And maybe the therapist can give us that, give me the structure, give me the session limit. And the therapist could try to find a way to give, the patient control in their sessions. But we also need to work on tolerating that discomfort of not knowing and
I
dealing with
hate
that anxiety.
that. The discomfort is like, you
Yeah.
have to live in the discomfort. I'm like, I don't want to be uncomfortable ever. Yeah. All right. So I want to now talk about the difference between all the letters after therapist names, because I think that confuses people.
It's so confusing. It confuses me too. Um, so, for example, my name is Rachel Luckman, PSY.D. A lot of people have no idea what that means. I didn't until I got the degree. And so for me, that means doctorate in clinical psychology. Another common one is PhD. And that is also a doctorate in clinical psychology, if that's the specialty that the psychologist received. The difference between PhD and PsyD is that traditionally PhD is more research focused and PsyD is more clinically focused. But if you're going online and that person's a therapist, PhD PsyD usually means they're a psychologist. They could also be a PhD of social work, or they could have their doctorate of social work, which is like the PsyD of social workers. A little confusing.
Yeah.
But basically, the letters after the name signifies the degree that the person has. So I know a lot of times with my friends, they'll say like, I'm in therapy. And I'm like, oh, what degree do they have? And they're like, I don't know, they're a therapist. And I totally get that. However, it is, helpful to ask your therapist, what do your letters mean? And sometimes people look for specific credentials. Having worked in college counseling centers and hospital settings, I feel pretty comfortable telling my friends and family to see people with the following letters. like I said, a PsyD PhD, they're usually psychologists. Also people that have, I have to think of the letter, LCSW, that stands for licensed clinical social worker. And those are people who got a 2-year master's degree in social work and then gone on for like 3+ years in supervised clinical training to be a therapist. And also people that are LMHC, that's a licensed mental health counselor, likewise got a 2-year or so master's degree and then have had ongoing training. And the L means that they're licensed. So that means they've taken a ton of exams and supervision, and the state that they're in has said, yes, this person's qualified to be your therapist. And there are many other letters out there, and those are great. I just think it's important to ask your therapist, like, are you licensed? And if they're not licensed, that's okay too, but ask them who's supervising you. What are their credentials? Just so that you have an idea, who you're working with.
Piggybacking off of that, let's talk about the different kinds of therapy. Like, I know there's cognitive and behavioral, and also how do you know what is right for you?
Mm-hmm. Yeah, so I think a lot of times when people go on certain websites, they'll see like treatment modalities, and there'll be like 20 different ones. It's like,
Right.
What does this mean?
Right.
So the ones that I am more familiar with are, like you said, the cognitive behavioral approach, CBT. And that is a pretty common type of therapy right now across the world. And it really works on in the moment challenges and having patients think about how their thoughts, feelings, and behaviors are connected. Oftentimes, there might be like homeworks in between sessions, like ways to like do experiments, and it will really be trying to like track progress quickly. Another camp that's like very common in New York still is psychodynamic therapy. I've been trained in both modalities. I think they're both great. Psychodynamic is like traditionally what we think of with Freud laying on the couch.
Right.
It's been changed a lot, and there's a lot of different types like object relations or attachment focused or EFT. And that type of therapy tends to look a lot in maybe past experiences, maybe experiences in childhood, looking at ongoing patterns in relationships, and really focused on like insight oriented, considering our defenses and how our defenses may be protecting us or harming us. And then there's even like this third wave that's very hot right now, DBT, dialectical behavioral therapy, and ACT, acceptance and commitment therapy, a lot of different types. So what I think is really helpful when people are looking for a therapist is to consider what they're trying to get from the therapy, and then be upfront with the therapist about that. So for example, as someone who specializes in eating disorders, my first approach is more cognitive behavioral, because a lot of times with people that are struggling with eating disorders, they need to stabilize first, have like regular eating and some improvements in those behaviors. And then once they're stabilized, then we want to go talk about what's going on in the past and relational issues. So when we see those letters of all the different types, it just shows that there's a lot of different evidence-based therapies out there, and everyone has different trainings. And it's really important to just ask your therapist, like, what does this mean? And how's that going to be working here?
I love that. I know a lot of people, I think in the times that we're in right now, I think one of the main things that people feel, because a lot of people are confused, right? They're like, I don't feel good. I feel down. I feel really anxious, and they can't really pinpoint sort of what it is, or you know what I'm saying? Like, they know they may have issues with food, or they may teeter on the line of, I may have an addiction, but I don't know specifically what the addiction, you know what I'm trying to say? It's not like a specific sort of addiction. If somebody's just really anxious all the time, because I feel like anxiety is just like a big thing that we're all experiencing at the moment, what would you recommend?
Yeah, I think if it's in the moment, I'm feeling really anxious right now and I need skills, I would recommend CBT.
Okay.
You can really see some like quick changes in behavior from that can help make the day-to-day more manageable.
Got it. Okay, cool. Now I want to talk about something that I don't know, I was going to say controversial, I don't think it's controversial at all. Medication. Can therapists prescribe medication? And also, what's the difference between a psychiatrist and a DMP?
Yeah.
Just talk about that a little bit.
Yeah. So a therapist like me, I cannot prescribe medication. So to be able to prescribe medication, you have to go to medical school. So a psychiatrist is someone that's a medical doctor, and they likely for residency went on to get specialized training as a psychiatrist.
Mhm.
They're really good with biology and understanding like the serotonin and all of that, and figuring out exactly what type of medication would be the most effective for treating exactly what's going on. A DNP is someone that has a doctorate in nurse practitioning, and they are extremely qualified to prescribe psychiatric medication. Those are people that usually started off as nurses and then went on for a lot more schooling. Like, I think the programs now can take like 4 to 5 more years, and they specialize in psychiatry. So you may see like on the internet that someone is a DNP, and they're qualified as well. And what's really helpful is if someone is taking medication, to try to work with someone that has one of these degrees. I know oftentimes people might get prescribed from their primary care doctor, which is okay and normal. But primary care doctors don't always have enough time to see people regularly and assess how the medication is working. So that's why it's really great to see a psychiatrist that's like covered by insurance, maybe a little more affordable, while also doing therapy. And sometimes they can work like hand in hand together.
Yeah, I think that's really important to get everybody who you are working with on the same page, because I think that, right, don't you, like the synchronicity probably just makes for more effective treatment, I feel like. Yeah.
Mhm.
Okay, so I know that I started therapy because I was engaged and
Oh.
we were having issues. And
Mhm.
then we were like, okay, we need to go see a therapist before we figure out what we're doing. And then we went, and then a month later we broke up, and then I
Mhm.
stuck with the therapist. And that's the guy that I'm seeing now. So when we talk about, and couples therapy was great because it was interesting. Like, every time I would talk about the guy, like, he would be like, no, I know the guy, that's not true. So it was interesting. But anyway, I really thought couples therapy was helpful. And somebody said, you're either gonna like strengthen your relationship, or it's gonna break you up. And we realized we weren't meant to be. So I really did think couples therapy was effective. And I think even when you're in a good place in your relationship, you should bring your significant other into into therapy with you. But what do you, if somebody's having, wants to go to couples therapy, what do you look for in a couples therapist? What advice would you give on that?
Yeah, and Shelly, thank you so much for sharing that experience, because
Yeah.
it's so real. I think in a training that I went to, I think someone had said that the average couple waits like 7 years to go to couples therapy, when they probably should have gone 7 years before,
Yeah.
to nip it in the bud, right? So it's really, I think, effective to go sooner than later. And even, healthy, well-adjusted, strongly attached couples go to therapy, because
That's how they
life
stay
is hard.
wealthy, health, and well
Yeah.
adjusted and healthy.
Yeah.
Yeah.
Exactly. So a few things that I think are important to look for in a couples therapist. One, you want to make sure that they have experience working with couples. It is just a very different type of therapy. And even if your like individual therapist like really gets you and you connect with, they might not be as competent in couples therapy. So you want to find out, like, do you specialize in working with couples? Like, how many years have you worked with couples? I'm going to throw another set of letters your way, but there's a degree called LMFT, and that's a licensed marriage and family therapist. Excellent. Their training is specific for this. Those who have gone to school and didn't have that specialized training, there are ways to specialize in couples therapy. The hot one right now is EFT. It stands for emotionally focused therapy. I am a huge advocate. And for anyone out there that's like considering their couples therapy, who's people that are even considering being in a relationship, there's an amazing book called Hold Me Tight. I push that book on everyone. It's by Sue Johnson, and it gives a lot of insight into how EFT works. And it's a self-help book for the individual or couple that really walks you through important conversations to have with a loved one. So I think, there are also a lot of other different types of couple therapies, but that's the one I'm most familiar with. And I think it is quite effective for couples.
Oh, awesome. Well, thank you for sharing that.
Yeah.
I will say this, the second I do enter into a new relationship, he will be sitting with me on the couch, you know, discussing whatever it is we need to discuss. So I think,
Yeah.
I think communication is key. And, when you're in a relationship, you're not always the best at it. So, sort of starting that early, I think is super important. It doesn't mean anything's wrong. It just means you want to, learn how to communicate better before you get to a place where something maybe does get wrong. So I think that's super important. And I really, I'm an advocate for that. Okay, let's talk about group therapy. What are your thoughts on that? And just explain more about that.
Yeah, so group therapy is, I'm hoping that it's becoming a bigger thing now, because it is so hard for people to find an individual therapist. And, sometimes you just have one therapist and 8 group members. And so
Right.
group therapy is when the group has something in common. So maybe it's grief, maybe it's an eating disorder, maybe it's being a single girl in New York City. There really are groups for that, and it's led by a clinician, and they have some sort of agreements, like we're going to meet once a week for 12 weeks straight, and some groups are more skills, like we're going to learn certain skills, or some of them are just more process and supportive and coming together with a community that's going through what you're going through. A lot of college counseling centers have groups. So I previously was at NYU's counseling center, and I think the group therapy that they offer there is wonderful. And it's just a really healing process to have people heal each other. And it doesn't necessarily have to be just a therapist and patient in the room. It's peers coming together to support peers.
I'm in group therapy. I love it.
Okay, there you go.
My therapist put us all together. It's like 5 of us. And it's definitely super helpful. Even if you don't say anything the entire time, just listening to somebody else speak is, you get so much out of it, and you have other people that are always there for you and you can depend on, and it's great. I'm an advocate for that as well.
I'm glad to have had that experience.
Yeah. So when the pandemic first started, obviously, I stopped doing in-person therapy, and I started speaking to my therapist on Zoom, and it was awful because it was so awkward staring at him with his weird headphones. And I was like, I can't like to do. So then we went to the phone, and I'm not going to lie to you, in the beginning, it was really tough because I was doing other things. I wasn't really paying attention to him. And I kind of lost focus a little bit, but now it's sort of, I can't even imagine going back in person, which hopefully one day we eventually can. But what, a lot of people are sort of hesitant. I know a lot of people dropped off when telehealth sort of became obviously the new normal. What, if somebody was to say, what is more effective or what is better, telehealth or in person, what would be your answer to that?
Yeah, so I am not too well versed right now in like the research literature of which one is more effective. However, I have been hearing that studies are coming out to say like telehealth is great, like keep doing it. And I think it just really depends on the person. So with telehealth, the pros are that, it's easier. You don't have to commute. I'm experiencing people, being able to see me in the middle of their workday when other times that they weren't able to. And sometimes people might feel more comfortable having that distance to share certain things that maybe they wouldn't have in person. I also think, in person is also really a beautiful treatment model because you are with another being and there are no distractions. And I don't know how many of us have, 45, 50 minutes a week where we have like someone with undivided attention on us. Yeah. And it also, I think, depends on what the person's working with. So I have some colleagues that are specialized in working with children, and it does seem a bit harder doing Zoom with the kiddos. So, if possible, to be able to do in person with kids or maybe to alternate can be helpful. Something that I think might be helpful for people to keep in mind is that we therapists are licensed in a certain state. So with telehealth, I know some people might just wind up being like in Aruba and be like, hey, Rachel, I'm in Aruba. And I'm like, that's great. I can't treat you. So with telehealth, you also want to just have that conversation with your therapist, like, what are the limits to telehealth? Where can I be treated? Where can't I? And really planning ahead about safety. Whenever I am working with someone remotely, I want to know the address that they're located, if there's an emergency and maybe I need to activate 911 or call someone in their emergency contact list, like where exactly are they located? And are they in a place where, they feel safe that no one is going to hear our conversation? If we're going to be talking about something traumatizing, then I don't want them sitting in their bed and then, having nightmares later there. So we also with telehealth want to be really cautious and thoughtful about where the therapy is being done.
Got it. So as long as the person that you're working with is super supportive in the process, the times that we're in, it's, if that's all that you can do, it's still a form of, therapy that may be necessary, even if it's not ideal.
Yeah.
So that sort of answered the question about, does the state that you do therapy in matter, right? I guess each state is different. Okay. Now I know this is a question that everybody goes into therapy with in mind, because people, like we said in the beginning, I am too, we all are, we're like, we want instant results. We're in the age of the microwave era, instant gratification. We want to know how long it's going to take to fix my problems and make me feel better. So if someone comes to you and they're like, how long does it take for therapy to work? How long until I feel better? How long until I no longer have to come see you? How do you answer that question?
Yeah, I get that all the time.
I'm sure.
And I tell them, it depends. I usually say, if things are really hard right now, then let's try to meet weekly. Let's maybe do something that's more cognitive behavioral and give you some skills so that we can make things feel more manageable now, and reevaluate in 6 weeks and see if any of this has helped. If not, then let's pivot a bit. It just really depends on the type of therapy and what the person is coming in with, and also their motivation for change, right? So it's not just on me, the therapist, to wave a magic wand. Everyone is at a different stage of change. And some people may be more so contemplating, are things really that bad? Do I actually want to do deep breathing 3 times a day? That's so annoying, right? So it really just depends on motivation, severity of what the person is experiencing, and the type of treatment. But I do tell people that I don't think the way that I work is that I don't think every single person I work with needs to be with me their entire life. If there are people that, that style works for them and have that connection with their therapist, then that's great. But oftentimes, I will see people for 6 months, a year or so, and things are better. And we can end therapy, and it's okay to break up with your therapist. When treatment's done, it's done. Yeah. And then maybe in a few years, something comes up and they want to come back, right? Or maybe, things are resurfacing, or they actually would benefit with a different type of therapist. And I will also, refer, some of my patients to my colleagues if, I no longer meet their needs.
Yeah. It's just about being present and doing the work and then seeing where that takes you, I feel like. Yeah. Okay, so here's another question for you. Do you have any self-help book recommendations that people can read on their own?
Yes, I do.
Everybody
Okay,
get them.
I have with me, so this is a great book that people really like. It's the Dialectical Behavior Therapy Skills Workbook. The first author on here is Matthew McKay. And this really helps people with getting skills. And you can work on your own, you can work on this with your therapist. A lot of group therapies work on this. And it really helps people with tolerating really challenging emotions, figuring out this idea of distress tolerance. So I want to feel better now, but like you might not feel better now. And so you have to figure out how to like write out that wave. There's a lot of good skills in here with mindfulness and also relationship skills on how to have, different conversations with friends or coworkers, etc. So this is a really great skills book.
Okay, awesome.
That's number one. I have a few.
Yes, keep going.
It's Not Always Depression. This book, my friend recently, she thought that she lent it to me, but I'm not giving it back.
Me, I do that all the time.
I'm like, you cannot have this, but it's really a wonderful book. And it gives, really, it's written for like anyone to read. And it really talks about how we may fluctuate sometimes between feeling sad or feeling anxious. And how do we, like, as you were saying earlier, understand like why we're having these feelings and get to, a deeper place of just reconnecting to our body and our emotions. And this book's just wonderful. And the third book that I'll recommend is called Stop Obsessing.
Oh, yes.
You know the book, or you're having?
No, I just like the title.
Yes. So it's called Stop Obsessing by Edna Foa. She is a specialist in OCD treatment, and her style is more CBT. So that book is just really wonderful for people that are having a hard time with, obsessing, and you might not have OCD or a specific anxiety, but that book can really give some helpful tips and insight into how to have some of those racing thoughts simmer down a bit.
Gotcha. Thank you so much. Those are really great recommendations. Before we get to the how do I actually find a therapist, there were just two more questions that I wanted to ask you. We were talking about bringing your significant other into therapy, doing couples therapy. But first of all, what if you're in therapy and you want to bring in, let's say, your brother, your mother, your sister, or your partner, just to, 1 or 2 sessions in your own session? How do you go about having that conversation? How do you convince them to come into a session with you? Because that can be kind of tricky and difficult. And I feel like a lot of people, sort of can use some advice and guidance on how to have that conversation.
Yeah. Shelly, that's a hard one.
Yeah.
That I don't know if I really have the answer for. Oftentimes I hear people say like, how do I get my friend to go to therapy because she really needs it? Right. And that's different. Having someone enter into your own therapy, I think that is really based off what the person is going through and why they need that person in the session, and really a good conversation for them to have with their therapist. And for the therapist maybe to support them through that. I don't know, there might be a reason that the therapist might think like that's not helpful. So it's interesting. I guess questions to ask like oneself is, why do I want this person to join my session? What would be the benefits? And like, how do I discuss that with my therapist? And then if that person doesn't really want to come into therapy, then maybe there's a way to have like an open-hearted conversation explaining like why it is important. And it might be scary to them, like, is this therapist going to judge me? And so maybe also just educating, like, I want you here because I'm having a hard time, and maybe they can, help me explain that to you, and try to destigmatize what it's like being with a therapist.
It's so funny. I brought my mom in twice and my dad in once. And I think I was more nervous than them both times. And I think by the end, every time I would talk about my therapist to my parents, they would sort of they would, before they came in, they would be like, okay, like, great. And now they're all like, now they feel so much more receptive. Like now they're like, they love him because they met him and they see like, he's not against them. You know, he's not telling me your parents messed you up. You know what I'm trying to say? Like they see that he was so great and he's actually like helping me become a better version of me, that they're like, hey, how is he doing? And, you know, tell him, hey, and, you know, so it's just a kind of a funny dynamic that, you know, if you can not disarm them, but sort of find a way to get said person in your life into this world for just a minute for whatever you need them for, the benefits can be so great.
Yeah.
All right, before we we're going to get into that because I think that's the most important thing. I just wanted to quickly talk about, because I think people are also confused of like, you know, out of network versus network, and then what's sliding scale.
Really important question.
Yeah.
So first step is the person has to have insurance for this conversation. So if anyone, you know, listening right now does not have insurance, that's okay. There are clinics that you can go to that are sliding scale, which means that they are flexible with your fee based off of like your income or maybe some other factors. Sometimes there are training clinics, like for example, where I got my training, where I saw people for free, or maybe for $5 a session. So if someone doesn't have insurance, I would suggest reaching out to like your local hospital. So like Mount Sinai or near Presbyterian Cornell, a lot of these hospitals, Bellevue, they have outpatient clinics where people can go in for low fee. If you have insurance, then you have a lot more options. So in-network means that you're finding a therapist that has a contract with the insurance company to treat you based off of like their fees. So trying to see how to explain this so it's not confusing. When you go to your doctor for maybe like primary care, your doctor is likely in network. So you may pay them like $40 to visit them because that's what it says on the card, $40. And then next to the card, there might be something that says like SPEC, which is usually for specialists. And it depends on your plan. That may be more money. So maybe like $70. And so when you see your therapist, every time you're just paying the therapist your copay. And then what the therapist does is they reach out to the insurance company and they send them, you know, a form that says like, hey, I saw this person, this is what we did. And then the insurance company pays the therapist back. So it's tends to be less stressful for the patient because you're just paying that $70 or $40 each time, which is pretty great. Any questions about like what in-network is? Was that probably a little confusing? I get a little tongue-tied myself.
No. That made actually a lot of sense. That it's handled on their end, and sort of it's easier for you. You're paying the copay. It's sort of like when you go to the doctor.
Exactly.
And then insurance, and the doctor and your insurance take care of it. You give your copay and you get on with your day.
Exactly. And so that's like when you get a new medical doctor, you might say to them like, hey, do you accept Aetna? And they might say, no, I don't. So you're like, all right, I'm going to go find someone who accepts Aetna, right? So out of network is also really common. And just so that you know about me, I accept one insurance panel. And then for the rest of my clients, I'm out of network. So I do a little bit of both, which is pretty common. And so for out of network, that means that I have a certain fee and the client needs to pay me that fee at the beginning of each session. That fee is usually not cheap because that's like the full fee. Like that's what I get, right? Then what I do is either at the end of the session, or what I typically agree with my clients is I do a super bill, which means at the end of every month, I send them a form and it shows like, these are the sessions that you attended. This is confirmation that you paid. Sometimes insurance companies want a diagnosis. And so I'll talk about that beforehand with my client, like what diagnosis do we think is appropriate, and talk about like those limits to confidentiality with working with an insurance company. And then the client will take that form and it'll have like my license number on it so that insurance knows that I'm legit. And they will then submit that to the insurance company. Sometimes people with out-of-network benefits need to reach a deductible first. So it really depends on your plan. So some plans, there might be a $1,500 deductible. And so maybe it takes like a few months to hit that. Then once you hit that, the insurance company may cover like 80% of your sessions. Some people actually don't even have a deductible and they can just start right away. It tends to be with a lot of people's plans that the deductible restarts January 1st every year. So that's why I'm telling people, like, if you're doing out of network, start now so we can start building that deductible. Some people do not have out of network benefits. And so you really want to be aware of that from the beginning. With some companies, you can, change your insurance plan, maybe like in October, November, when like HR reaches out to you and says like, hey, do you want to continue your plan? That's a good time to be like, do I have out of network benefits? And maybe like do a little bit of like a cost benefits analysis to see if it would be actually cost effective to like pay a little more for out of network benefits,
Right.
so that you can see those types of specialists.
Very helpful. It's very confusing, but you broke it down perfectly. All right. So lastly, with all this information, somebody's ready to start and they're looking for a therapist. How do they go about doing that?
Yeah. So step one, if you have insurance, call your insurance company and clarify with them as many times as possible what the in-network and out-of-network situation is. And also ask them, do you have any referrals for therapists for me? And a lot of times they might transfer you to behavioral health. Well, you'll actually speak with someone that has this like specialty training and talking about mental health. And they'll have like a list of therapists with different specialties that accept your insurance. So that's really great. The next thing that I would do is go on psychologytoday.com. And we're all on there. I'm on there. You can see this like really awkward picture of me. And Psychology Today is really great because the organization verifies that we are licensed and credentialed. So you can feel pretty comfortable that the people that are on that site are competent to be your therapist. And then from there, you can filter like insurance, or people will put on there like what their out of network fee is, what their specialties are. And so that's really great. I love Psychology Today. The third one that a lot of people have been using lately is called Headway. And Headway is a service that can help connect people to therapists through insurance. So I think those three are really helpful. If someone is in college, I strongly advise reaching out to your counseling center. They have amazing referrals for therapists that are off campus in the community.
I guess my last question would be, if somebody doesn't have insurance, which I hope a lot of people do you have a recommendation, do you know, on what to do?
Yeah, for seeking therapy?
Yeah.
So there really are a lot of like low fee clinics that work with people that don't have insurance.
Okay.
One that I think is pretty great is NYU has one called the Center for Counseling and Community Wellbeing. And it says like on their website that like the first session is $50, but then going forward, I think it's less. But also if someone really doesn't have the financial means, I have a feeling that like they might be able to adjust or figure that out. So that's a great source. I can really talk best to New York City.
Yeah.
I used to work at Elmhurst Hospital, and there are a lot of people there that don't have insurance. And there's an outpatient clinic there where you can see a therapist, and no insurance needed. Bellevue also has those services. And really just, looking online, Google is really helpful. And so typing in low fee clinic, there will be a lot of resources that come up.
Awesome. I mean, Dr. Luckman, I really enjoyed speaking with you. I think you gave us such useful information. I think you definitely helped a lot of people and at least educated a lot of people today. And I think it's super important, especially with what we're going through. I mean, everybody just needs somebody to talk to, and the process can seem really overwhelming, but when you break it down and you sort of say, here, just start here or do this, it makes people a little bit more, I guess, receptive to the idea of reaching out and getting the help that they need. So
yeah. And thank you so much, Shelly. I'm just
course.
so excited now having spoken about this. Like, everyone's going to go find a therapist now.
Yes.
So thank you so much for having me on.
Absolutely. Mental health is wealth. And I mean, I really like therapy. I've benefited from it so much. And I highly recommend it. So we appreciate you for joining us, and hopefully this was useful to you. And if there's any links that we want to post or we think are necessary, we'll post it in the chat. And hopefully we'll talk again soon, because this was great.
Yeah.
Maybe there's more ways that we can help. We're going to explore that.
Great. Thanks so much.
From the top of the Empire State Building.
C100.